Despite years of advocacy, people living with HIV/AIDS in Nigeria say they still face social stigma and discrimination. In commemoration of the World AIDS Day, Just Nigeria's Vivian Oguche met with some of them who talked about their everyday life experiences, access to healthcare, employment, social support, and more. Her report is presented by Mercy Frank.
I knew that I am definitely going to die, so I continued to plan my burial and everything.
They would tell me, go to the junction, pick sand, boil it and drink. I will drink.
You are strong and you drink a lot of kai agbo that you cannot be infected. Who says?
A health condition misunderstood by many. Yet, persons living with HIV cling on to hope. Oguche Kadiri looks hale and hearty, but 18 years ago, she was pushed out of her home and left for dead.
They've rejected me in the hospital, and now I'm going home. So getting home was like, I expect a family to even say, welcome, but the shock was not there. It was like, why are you here?
They would treat me malaria, treat me different kind of sicknesses. But at the end of it, I would still come back with, I was not getting better.
As the international community acknowledges progress it has collectively experienced, Nigeria has a significant share of the burden, especially in poorer communities. Recent figures by the Borgin Project, a non-governmental organization, indicates that as of 2021, there were 1.9 million Nigerians living with HIV, just like Oguche and Patrick. In the same year, there were 74,000 new infections and unfortunately 51,000 AIDS-related mortalities. From these figures, Nigeria has suffered the most significant HIV epidemic in West and Central Africa. Despite this sad picture, there seems to be some progress. New infections are falling, with the number of recorded cases dropping by more than 10,000 between 2019 and 2021. But is the war over?
The war is not over. It's just that we need to continue to remind ourselves of all the things to do.
Can say it's progressive, but compared to other countries, we are still very far from where we are supposed to be.
So it's no longer that kind of picture that people used to paint in those days of one skinny person. No. Things have actually improved.
For the survivors, HIV-related stigma and discrimination remain persistent barriers.
HIV is still a pandemic?
No, I don't think it's a pandemic in Nigeria again.
No, because the knowledge has been spread.
For the survivors, HIV-related stigma and discrimination remain persistent barriers.
I was the coordinator of the support group at NIMA, at Nigerian Institute of Medical Research. So they called me to speak on behalf of people living with HIV. It was a kind of stand-off party. I left some people on the table. We were sitting in a round table. Nobody knew who was who. So when they called me to come to the podium to speak, I went, I collected the mic, I spoke. I spoke on behalf of people living with HIV. But when I came back, there was nobody on that seat again.
For me, I have fought stigma, I have overcome stigma, and I have conquered stigma.
But for average Nigerians, being around persons living with HIV is no longer a scary prospect, as was the case a few decades ago.
Anyone with HIV is still a human being and need not to be stigmatized.
You show them love, you make them understand the fact that it's not the very day you contact AIDS that you die, HIV that you die.
Someone I know of that contacted AIDS some years ago, an elderly man, but he lived, grew old and died. Normal death.
So, what do people get wrong about the virus? But let's begin with the myth that you can tell someone is living with HIV by merely looking at them.
No, that's not true, because it's not something written on the forehead
or you walk about it, or like a placard.
Another myth is that HIV only affects certain sexual orientations.
Heterosexuals, homosexual, there's nobody that can't get it.
The conspiracy theorists also say that HIV affects fertility.
So even in the healthcare system, they are not very clear on on how HIV affects goes with the reproductive health of women.
Another commonplace myth is that if both partners are HIV positive, there's no need for condoms.
We have HIV type 1, we have HIV type 2. So until it is diagnosed of the type of HIV virus this other one is, they both are still encouraged to use condom for HIV prevention because of mutation.
HIV can enter the blood through linings in the mouth, anus, penis, vagina, or through broken skin. This leads us to the fifth myth that says you can get HIV by sharing utensils with persons living with the virus.
HIV cannot be transmitted through cup, through plates, through eating together, sleeping on the same bed, hugging. No.
Another myth that has stopped hearts is that HIV is a death sentence.
I've lived with a wife, a woman, who has been negative for that number of years, 17 years. And we have children. She's not positive till today.
The consensus then is that when people know more, they will be less inclined to shame people living with HIV and more likely to provide the support and encouragement that they need.
During the early 2000s, major initiative among donor countries brought treatment to the poor with the help of host countries. In addition to this, the National Agency for the Control of AIDS, NACA, the agency coordinating HIV activities in Nigeria, says it is expanding its work to include more research, more awareness, and more comfort for caregivers. However, there is the pressing issue of donor fatigue.
Now it's more of security, it's more of maintaining those who are already infected, and so the donor fatigue has already setting.
So it is time for Nigerian government to start thinking about sustainability.
We're slowly looking into that. We're strengthening our private sector coordination. We've done a lot of strong PPPs.
But beyond the politics, stakeholders insist that giving priority to the welfare of persons with lived experiences is pivotal in achieving the third Sustainable Development Goal to end the HIV/AIDS epidemic by 2030. This will be achieved when the number of new HIV infections and AIDS-related death decline by 90% between 2010 and 2030.
There is absolutely no reason to discriminate against people living with HIV/AIDS. Do you have an HIV story to share? Tweet at us at Just Nigeria TV. Would like to hear from you.